Welcome to Rural Health Pulse. I'm Jim Kinnear, Chief Human Resources Officer at the Indiana Regional Medical Center. In this series, we focus on ideas and stories impacting the health of our region and explore the programs and initiatives designed to improve healthcare and wellness. This podcast is a collaborative effort of IRMC and Indiana University of Pennsylvania. In this episode, we are joined by Dr. Lou Pesci with the IUP Institute for Rural Health and Safety. We'll learn about how the Institute brings together university personnel from various disciplines and professional backgrounds to solve rural health problems. It's my pleasure to welcome our guest for this episode, Dr. Lou Pesci. Dr. Pesci is the faculty member and director of the IUP Institute for Rural Health and Safety. It's great to have you here as a guest on the Rural Health Pulse today.
Thanks, Jim.
To get started, could you give our listeners an overview of what the IUP Institute for Rural Health and Safety does?
Okay, I can start with the history of the Institute and how it's changed over the years. The Institute used to be called the IUP Highway Safety Center. The Highway Safety Center was started sometime in the 1980s, and it fell under what is now the Kinesiology and Health Sports Science Department. Back then it was the Health and Phys Ed Department. So the names have changed over the years. But in the 1980s, they had a variety of things in the Institute. It was really a lot. We had a lot of transportation. We did the safety ed driver education. We also had the EMS side of it, and the EMS side of it was really emergency medical technician, EMT. There were other components of the Institute which divided off, or the Highway Safety Center, which used to be we had the Criminal Justice Training Center, which was in the same building. There was also, we had the DOT, which is a Community Traffic Safety Program, which I can talk about later, which is back in play. And a lot of other grants. We took care of the power plants, local power plants, training and that. So over the years, things have changed, but probably the biggest change is we did move in, I think it was 2015, the Highway Safety Center was moved out to Citizens Ambulance off of campus. So we used to be in the old R&P building on campus, and we did that to align with what was going on in the EMS world. And also we changed the name at that time to more accurately reflect really what at the time the Highway Safety Center was doing, because it just wasn't highway. Transportation, yes, was there, but we changed it. And because we also work in a lot of rural areas. So it was changed to the Institute for Rural Health and Safety. And like I said, that was right around 2015 and 16. In 2019, we moved out of Citizens or 2020 in that time frame, and we came back on campus. So we were on campus a long time ago, probably back in the 70s and even the 80s. There was a piece of it that was in Keith Hall, which is no longer on campus, and that was mainly the EMT. So what we did was whenever we moved back into Zinc, everything really fell under the Zinc Hall. So what is there now, we currently are doing EMT, so we still have the emergency medical technician. We have now picked up paramedic, so we do have a paramedic program. Both those are clock hour programs. We still carry the safety ed driver education program, the 12 credits, that is courses that lead up to certification for driver education teachers. We also have the Pennsylvania DOT, Department of Transportation Community Traffic Safety Project, which has been around for a very long time. So it is also housed in Zinc, and part of it is also housed on the South Campus in the trailers, which is where our main office is. But the training is done in Zinc. What else we have? As you know, the American Heart Association Training Center was several years back, I think in 2019 or in 18, somewhere in there. IRMC passed that over to us, called me one day and said, do you want this? And we said, yes, we can take it. It'll align with what we're doing. So we picked that up. And so we have quite a few pieces over the years. The Institute has pretty much still filled the needs of the community. We say Western Pennsylvania, but we're spread out through really our programs. We draw people from all over. So it was really to help the community and for workforce development, a key term that's been widely used right in these days. So we still really hit big on the workforce development. whether it's programs, certificates, whatever you want to call them. And that's really where the Institute stands right now. It is a small group of people, I'd have to say. I am the faculty member that oversees the Institute, but what falls under, we have Tamara Bork. She is the paramedic program director, and we also have Sarah Dalheimer, who is the assistant paramedic director. We also have Eric Dawkins. Eric Dawkins really handles what we call the basic life support side of it. So he really looks at the EMT side of it, where Tamara handles the advanced life support side of it, which is paramedic. We just recently signing on, we have a new employee coming in on Monday to work the DOT, the Community Traffic Safety Project. That will be Amy Shellhammer. She'll be starting that on Monday. And we also have our secretary, Tracy Gordish, who handles, all those daily things that have, for the Institute. So we have a small group, but it works out well. So that's really the history.
Well, thanks for some of that background and giving an overview. One of the areas that you mentioned there was the Center for Emergency Services Training, and you alluded a little bit to the differences between the EMT and the paramedic program. Could you just expound a little bit more in terms of the differences between those programs in terms of content and course hours?
Sure. The EMT program is roughly 152 hours. Now, it is a clock hour program. We had that converted. And the EMT program is a much shorter program. So it is offered in the fall semester, it is offered in the spring semester, and it's also offered in the summer. So we align with pretty much what the university does with a regular semester. It may run over a little bit or start a little bit earlier, but the EMT program has, it is 152 hours, and it consists of the cognitive part, the classroom part, and also the lab part. And you also have the 10 patient contacts with it. When students are done with that, you have to be an EMT first. Then you can move on to the paramedic program. The paramedic program is a lot larger beast. So you're looking at a program that is 1,150 hours. The paramedic program runs it's a one-year program. So if we start in January, it will end in January the following year. Or we start in September. So we really have two cohorts. We have one that starts in September, and as it's running, the other one would pick up in January. And so we're running two cohorts at the same time. Paramedic, much larger. When you're looking at the cognitive part, the lab part, the clinical field, all that. So which makes up that 1,150 hours. The cost of it, the same thing. EMT, much different. It's $550. Versus a paramedic program, which is $7,500. So the scope of the practice of what the two can do is large. So you have two different sets of standards for both of them. And as they come out, they both take one will be taking a national registry exam for EMT, the other one taking a national registry exam for paramedic. So we pull students in into the program. And one of the interesting things about the EMT, and this is really the way we have it set up is, and this leads into trying to get people into the field of EMS, but also at the same time trying to cater to those that are going into the medical field, different degrees in that. So when you're looking at EMT or even American Heart, the very basics of going through a basic life support or CPR class, somebody starting into it may look at it and say, hey, well, what's next? I'll go into EMT. Yes, we try to put boots on the ground to try to help all these EMS agencies out there, like Citizens and the different ones are out throughout Pennsylvania, to put people, into those ambulances and to support that. But you also have the other side of it is these students are using it as a stepping stone. So if they're going into some medical field, whether it's, PA, PT, OT, or if they're going into, whether it's a DO program or a medical or whatever, we do have students who do that. So if they're coming out of our department, like exercise science, which falls under the kinesiology, health, and sports science department, we do see students who are in that, and all at once they jump into EMT. And what they're doing is they're trying to build those patient contacts. So they jump into EMT. Do they have any desire to sit on an ambulance? In some cases, no. They're doing it just to go on. So once they become an EMT, they graduate from IUP, and then they move on into some other medical field. So we also, we pull people from all over from some, the rural areas. So you have to remember with EMT is, yes, we do cater to IUP. We have a program here on main campus. We're also running at Pitt East down in the Monroeville area. But we also have programs such as up in Coudersport that we run. So trying to meet that rural area. And the students in those outlying areas, we hope they would come to IUP, and go on to the paramedic. But a lot of them stay, they stay local to help their agency out. And that's really, places like Citizens really need those boots on the ground and those people to fill, that workforce development. So there are differences between the two programs, but they lead into each other.
Thanks for explaining those differences and that connection between the two. What's the typical enrollment in those programs?
Well, EMT, because EMT is a shorter program, you're looking at, we try to hold between 20 and 24 students. So if we're here at IUP Maine, it holds in that area. We don't like to go over 24 because of the instructor ratio. So we try to keep it between 20 and 24 for running. Pitt East, it can be holding at 18 or 20. It might dip down to 12. It just depends. And those programs, EMT is run not a typical college day, as I say, a college day where you're there for a 1 hour day or 50 minutes or whatever, or 2 or 3 hours. EMT is set up that it is a hybrid. So the students would do all their cognitive learning online, and then they would come in a Saturday, Sunday. So they would meet 6 days out of the whole semester, spread out through the semester, Saturday, Sunday, to meet those 48 lab hours. So, when you're looking at that style, we have EMT it can be offered in a lot of different places. So, and it can be, like I said, in a lot of rural areas is where the need is. Paramedic, a little bit different. Paramedic is, run on a Monday. They come in, they do their hybrids, their cognitive learning, they do the lab work. And then once they're done with that Monday's lab work, they're out doing clinical field rotations. So, but the numbers in paramedic, when we first started off, I think our first cohort was 28, I believe it was somewhere. But as you know, you lose students as you go along. But it holds somewhere right around 18 or 20. It can dip down around 12. So it can be a little bit smaller, and it just depends on the number of EMT students. We're starting to see more EMT students saying, "Hey, I like the program here. I like the instructors. I want to continue on." So we're starting that pipeline, really to beef that up, and it's working. So the numbers between the two, when you say EMT, if we're running two programs, we can end up between the two 40 students. If we have some at Pitt East, we also have some at North. So in a fall semester, you may end up in that time frame, 40, 50 students, whereas paramedic is only going to be somewhere right around that 18 or 20, as high as 24.
Thanks for that insight in terms of enrollment. Are both of those programs non-credit programs currently?
All right, both of the programs are non-credit. They are clock hour programs. But with that, you can do transfer credit. So there are articulation agreements with the kinesiology, health, sports science department, and also the biology department. So a student who is at IUP, or let's say they have their certificate, their national register exam, they're an EMT, and they're coming from a different state, and they want to come to IUP, and they're going to go into the biology. With that piece of paper, that certificate, they can have 4 credits transferred. All right. The same with paramedic is 30. So much larger program, but it carries 30. And that's also with the kinesiology and the biology department. So they are what they call clock hour programs.
So as you were mentioning earlier, these are not programs that necessarily are outcomes or end results in themselves of just becoming an EMT and ending there, but it can really be a foundation for other pathways, other degrees as well.
Oh my, yes. And that was one of the reasons why we built it. The pipeline was built to try to, one, yes, for recruitment to the university, but also to give these students other avenues when they're leaving the university. So it just doesn't have to be an exercise science student or a biology. It can be anybody. It can be any discipline across campus that they may say, hey, I can go back to my town and I can work as an EMT. So they may pick it up, and they may have no desire to go any farther into the medical world, but they stay as an EMT and they work, during the summers or whenever. And so it is a pipeline. Would students, the question is, would those students go on to the medical fields? Those numbers, I really don't have those numbers, Jim. We don't keep track of it. The only thing we do is as an exit survey, about the program and that. But following where those students really end up, the only way we find out is if the student says, "Hey, I've gone here, I've gone there." So we know the pipeline is working. But it is really for any students who would want to become an EMT. The stepping stone, most certainly it is a stepping stone. And we're starting to see more of that right now.
Building on that idea of that stepping stone, I understand you're doing some work around a public health degree with a focus in emergency medicine. Can you share a little bit about that?
Yes, the public health side of it is Dr. Christy Storty in our department. So she is the director, the one in charge of the public health. So I paired up with Dr. Storty and also Mr. Scott Decker as part of that program also. And one of the things that we looked at, or they were going through and saying, okay, we have public health, and it was starting to get more students interested in it. We said, why don't we throw something like a PIP model? And I'm talking about UPMC and that what they have with their emergency medicine. The students go through, they become a paramedic in the middle of the program, and they exit out with this degree. And I said, why don't we try that? And so Dr. Storty was very instrumental of getting that to go. So we have a public health degree with emergency medicine. So the student coming in would be, as a freshman coming in doing their coursework, and then at some point along that time they become an EMT. So they go through the EMT courses, and then back into the regular, taking the regular courses, and then it's mapped out that they become, paramedic students, and then they have that 1-year program. So then as they leave the program, yes, they have a baccalaureate degree in public health, but also they come out with that certificate as a paramedic. And the interesting part of that is when you're looking at what the hospitals need. They need those administrators, those pre-hospital care people who understand public health and also at the same time, can relate to the trauma side of it. So, and that's another little niche that we're filling in. So, but that program is it's just new. It's just starting off. So it is available right now. So students can be signing up for it.
Well, that's great, and it's really interesting to see that what your center does is there's definitely a workforce shortage in the emergency medical field, and we could talk a little bit about that. You're addressing those needs, but it's really a foundation for people to go into a lot of other fields. So building on that public health degree, that could be someone who might follow with medical education or pursue another discipline or field that they could continue to build on that addresses some other shortages in the healthcare field as well.
Yes, most certainly. And those students, like I said, coming out of public health has a lot of different components to it. We focused on the rural side of it. There was a big need for it, but also filling the shoes, not only whether it's for the hospitals or for those small communities or the pre-hospital side of it. But there's a lot of different pieces they can go into. I think people, when you look at public health just isn't that medical side. Public health has a lot of fingers to it, and it stretches into a lot of different areas, from disease to different curriculums and that, whether it's dealing with, the alcohol, the drugs, the opioid epidemic. So there's a lot of pieces to it. But that specific part that we have with public health is EMS, and it's geared toward that side of the medical component.
We've talked a little bit about the shortage of EMS. Anything you'd like to add to your perspective of that shortage and the need that's out there for EMS personnel?
Yeah, it always, EMS, you hear this in the newspaper, you hear it all over, is, the lack of funding. That's, just a big part of it. People aren't going into it. I think a big piece of it is the funding of it. You have a shortage, if you could have the somebody coming as an EMT, making more money, somebody as a paramedic making more money, and something has to change in that. And if, it's an important job, and to go through as an EMT or as a paramedic, it's a lot of work for these people. So, funding of the local agencies and that, you'd like to see more funding. You'd like to see the state putting a lot more money into it, helping these these local agencies, because when you lose your EMS agencies, and as we know, a lot of them are shutting down, they just can't survive. Then what happens? I think that's the big question in a small area. It's nice to be able to call 911 and have an ambulance. If you're, that issue is whether it's cardiac or whatever, somebody is there. But in some cases, because there is a shortage, they might not be able to get there as quickly. So you'd hope to fill it. You'd hope to put more money into it. And, after going through, I think, COVID, the COVID pandemic taught us a lesson about it. There's a need for it. There's a big shortage, and how do we replace these people?
As that shortage continues, do you see the audience that you potentially draw to your programs increasing in terms of the geographic area that you might pull people from?
Yeah, we pull people from, when we first started, I think we were pulling, we pulled people from all over, but we've seen people coming from different states, and that's based off of cost, from Maryland, from New Jersey, from the Philadelphia area. So we're pulling people from all over. We do pull them, north, when you're looking at the northern counties, above I-80 and that. So we're pulling people down to IUP, and that's just because of the structure of the program, the cost of the program. They like it because they are currently working. They're trying to fill the need of their local agency, and to come to IUP for one day out of the week, it fits their need, and the rest is hybrid. So they can go back and they can do everything. The other neat thing about our programs is we have a lot of affiliation agreements. So part of our program is if a student does have to travel long distances, they ask, hey, can I have affiliation agreement with whatever their agency is, their hometown, EMS service. And so that's done relatively easy through IUP, so that they can go back after they, spend time here doing their, their lab work, and they go back and they can do their field rotations there. We have, with clinical rotations, we have affiliation agreements with, I can't tell you the number of hospitals, but quite a few. So we're trying to meet and cater to those students so that it makes it easy on them, so that they can still continue working in their local area to fill those gaps.
Thanks for sharing that. It's really impressive to think about the area that you're drawing students from and the impact that you're making beyond our immediate region by helping to address some of those workforce shortage needs. I know you mentioned earlier that another part of the Institute is the Center for Transportation. Could you share a little bit about that area and what it does?
Yeah, the Center for Transportation, we have always had, IUP has carried safety of driver education certification for some time. And these are the courses that lead up to certification. So safety of driver education was the mainstay of it. So when you look back at the Highway Safety Center, that's really, where it originated. IUP, along with the Pesci system, and you're looking at the other 14, the other schools of higher ed, 14 others, driver education certification and the courses were embedded. Where they were embedded within those universities, ours was found under health and phys ed, which is now kinesiology and health sport science department. So when you look at all the different universities that had driver education, it's slowly dropped. You also had, I believe Pitt had it, Penn State had it, the bigger schools had it, but it slowly died off to the point right now, IUP is the last one that carries that. So when you look at driving in general and driver education, there was at one time there was a lot of money put into it, and it kind of goes back and forth on that. There's still a big need for it to train the 16-year-olds, those that are coming up through the graduated driver licensing system. But the courses that we have here at IUP fall under the kinesiology department. It's for 12 credits. And the student taking those 12 credits would be able to then go out, and whether they're going to open, a private driver training school, open up their own business, or they're going to go into the public schools. The public schools at one time, a lot of public schools. I think right now in the state of Pennsylvania, I think we have 500, don't quote me on that, 500 public schools. And out of those, you had well over half of them that had driver education that were embedded in the schools. Now you start to see that slipping, and I don't know the exact number, but it's less than half right now that have it. So we still cater to that. We still have the courses that are available for people to take that if they want to get into that, and also if they're going to go into some other transportation. So it's also a stepping stone. And it does tie into public health. As people say, driving in our highways has been a public nightmare with all the injuries and the deaths that we had. So we still carry that part of it. And driver education is, people always ask, well, where was driver education ever started? Well, from what we know of, it actually has its roots in Pennsylvania, we believe, going back to 1933, Amos Neihart out of State College. So we think that's really where it originated, what you can formally call getting into a car and, doing driver education. And so driver education has changed over the years. Now you have simulation, you have a lot of different things, but we still carry the components of the behind the wheel here for the training. We have the cognitive part. We do have simulation, and we also have a multiple car driving range, which we can hold 6, 7, quite a few cars on, which is really just to do parking exercises and different maneuvers, which ties into the behind the wheel component. So you put them there in a safe, low-risk environment and then move them on. So the safety of driver ed it's still here. It's still a component of the Institute, but I'm the last, really, that I know of, I'm the last one that is doing the training for the state.
And looking a little bit at your website, it's just not initial driver education. It looks like there's also a component of driver re-education as necessary as well.
Yeah, we were, when you look at a component of bigger corporations, so yes, we were doing the novice drivers, or I'll call them right now, we'll just say 16-year-olds, so let's just stick with them. Yes, that's where GDL really focuses on, but after age 18, driver education, it's not required in this state, so you don't need it. And once you're out of, past age 18, there's really no formal training needed. So unless you go to a workplace, you're working for a big company and they say, hey, you're going to be driving, you have to go through our safety program, which involves driving. And so we did a lot of that at the time. We did a lot of driver proficiency training, which was both teaching, older drivers and younger drivers how to use their eyes and then putting them into different maneuvers. So yeah, we had two sides of it, catering to the 16, 17-year-old, getting them in. And it doesn't mean that you just have to be 16 or 17 to get in driver ed. I had a lot of people that were, 40s, 50s, in their 80s saying, I need to learn how to drive. And so they'd come through a driver education program, which leads us into that, what we call novice driver. So we're not really putting an age to it. The corporate side of it, yeah, that was a big component. We don't do as much as that anymore, but we do, if a company would say, hey, we need some type of one-day training, 8 hours. Our insurance company, we need to meet some type of regulation or need within the company, we would do that. So we'd put them through a driver proficiency program, and we worked with a lot of different groups out there throughout Pennsylvania, that we would put them through these programs, put them on a driving range and do all the different maneuvers. And we catered to them. Some companies would say we want to focus on strictly backing because 80% of our collisions in the company are backing. So we would listen to them and we would focus on that. And, we trained a lot of people in a day, but we don't do as much as that as we used to.
Thanks for sharing that. And one of the things you touched on earlier that I thought was really interesting is from the outside, driver education and EMS might seem very different and separate things, but it really does connect under that umbrella of public health.
Oh, yeah. Public health, when you look at driving in general, I mean, there's a lot of people that do die on our highways across the nation. Pennsylvania, we have windy, we have back roads, we have all the snow, all those different things that, cause the problems. And yes, the two are connected. So you're looking at, okay, you're going to have these injuries out on the highways, but you need a very strong EMS side of it. So you need, whether it's the trauma centers, the hospitals, the ambulances, everything, the helicopters to get there and to help mitigate the issue. So yeah, they do fall under the same, public health. They do fall under the same umbrella, most certainly.
Great. Is there anything else you'd like to share about the IUP Institute for Rural Health and Safety?
Yeah, another program dealing with transportation, and I want to bring this one up, is this goes back into the 80s also. We have a grant that was the Community Traffic Safety Project through the Pennsylvania Department of Transportation. And we had that for a very long time up until 2018, and some rules changed on that grant as of who could apply for it. And instead of just letting it go, the Department of Transportation said, hey, let's think of another idea. How can we work this in? So with the Novice Driver Education statewide program project, we got a grant through the Department of Transportation, and it was really through Dr. Tim Runge, myself. We worked with looking at certain behaviors. You're working with the high schools, local high schools, looking at really cell phones, the distractions in it, and also seatbelt use. And we tied that together with the driver perceptual program. So we updated that for the Pennsylvania Department of Ed as part of that grant, and that's currently right now posted on our webpage, and it also links over to the Pennsylvania Department of Ed. But what happened with the CTSP in 2018, it left and we filled the void, but the problem with it is the counties that hold District 10 in Pennsylvania, there was no CTSP program. It was left empty. So just recently, the DOT reached out to me and said, "Hey, we would like to bring this back, and we need to figure out how to get it back, and we'd like IUP to be part of it." So, with the help of what we did as the Indiana County Commissioners, Robin Gorman was instrumental in getting that, and in all the different counties. So, which is Indiana, Jefferson, Clarion, Armstrong, and Butler counties. All the commissioners put their funds together that they were allotted for the CTSP and put them together under one umbrella through Indiana County, through the commissioners, and which it came to us. And that started in October 1st. So the new the CTSP program is what I'm saying is back and running. So we have, like I said, we have a new person with that. And really what that program or that grant does, it is a liaison. So is it public health? Yeah, it's a big component of public health. So you're looking at a piece, IUP being a liaison in helping these different counties, crunch data and numbers. You do have fatalities and injuries. And it's just, when you look at transportation, now you're getting into whether it be large vehicles, commercial vehicles. You're also looking at motorcycle safety. You're looking at pedestrian safety, bicycle safety. There's just so many components that fall under transportation, and you're also looking at the law enforcement. So it's a really close tie-in with law enforcement and getting public service announcements out that the National Highway Traffic Safety Administration puts out from the federal government of all these different initiatives, and there's something always going on, whether it's Motorcycle Safety Awareness Week, or it's pedestrian or distracted driving or something like that. So, and that is we're back into that. It's slowly, it's gaining more. Like I said, it's been stagnant for some time. So we're bringing it back alive, and we work. The groups you can work with are the sheriff's departments, local law enforcement, both the state police. You're also working with the pediatricians, because if you're dealing with child safety seats, you want to get them involved. So it's really that person's responsibility to try to get the word out. And it is a lot of social media. We have the Facebook page. In the past, some of the bigger things that we did with it, we had the safe driving competition, which was, for those counties and for those schools that had driver education programs, and the students would come through and do, it was really a tournament is what it was. We used to do non-alcoholic mix-offs. So there's different components of working with the local schools, just not leaving them out. But it is something we're bringing back to life right now. So you're probably going to be seeing more of that in the media and trying to get those announcements out, just making everybody aware of what's going on with transportation.
Well, thank you for sharing that. I mean, it's really fascinating to hear all the things that the Institute for Rural Health and Safety is involved with, and the impact, especially given relatively small core number of people leading that. It's just very impressive to learn about it.
Thank you.
So just want to thank you again for being a guest here today, helping us learn a little bit more about the IUP Institute for Rural Health and Safety. And your contributions to rural health are, again, very impressive, and it's a great story to learn about.
I am thankful for being invited here and being able to spread the word. But I appreciate it, Jim. Thanks.
Thank you. In this episode, we learned about the numerous programs and initiatives that are part of the IUP Institute for Rural Health and Safety, and how they are working to address important issues such as emergency medical services and transportation safety. Rural Health Pulse is a collaborative effort of the Indiana Regional Medical Center, Indiana University of Pennsylvania, and the Indiana community. It is produced by Chris Korn from IUP's Division of University Advancement and recorded by the IUP Communications Media. I'm Jim Kinnear. Thank you for listening, and be sure to watch for future episodes of Rural Health Pulse.